Our robotic system basically integrates our navigation system, which allows us to plan the procedure in advance, and it interfaces seamlessly with a robotic system, which allows us to, in almost automated fashion, insert these screws exactly where we need them to be. For example, we have to do a long fusion. A long fusion would be, for example, fusing, say, from the lower thoracic area, T10, T11, all the way down to the tailbone. And sometimes we have to put screws in the pelvis to provide an anchor for a long fusion. With that type of fusion, it's very beneficial in terms of efficiency and patient safety to really have everything planned out in advance. That plan is done with the assistance of a robotics consultant. It's put into the computer, which interfaces with the robot. We also get a CAT scan in advance of the patient's spine, and that is also fed into the computer so that we have a virtual roadmap as to what the operation is going to look like. What the robot does, once we provide the necessary exposure, once we have freed up the nerves, if there's a need for putting, for example, cages, we do that usually under X-ray guidance. But when the robot is tremendously helpful is the final stage of a fusion, which is applying the rods and screws that are necessary to provide stability for the spine, again, especially when it's a long construct, a fusion that spans sometimes the entire lower back and sometimes a little bit beyond that. So once everything else is done, we bring the robot in, and the robot has already been programmed to go to specific locations in order, usually starting from top and working our way down. And so the robotic arm is very precisely controlled. It has sub-millimeter accuracy. It will take the arm precisely to the first starting point. It has something that looks like a tube or a funnel. The tube provides the guidance for our instruments, the drill, the tap, the screwdriver. So we go in order. We start at the very top, say on the left. It guides a screwdriver, it guides a tap, it guides the screw itself, and then we move on to the next space. And so without having to, this might sound bad, but without having to pause to analyze and think about each trajectory as we move along, it's already been planned. So everything is seamless and it proceeds very efficiently, particularly when you're talking about one of these bigger spinal operations.